السلام عليكم.
وعليكم السلام ورحمة الله.
وعليكم
عليكم
السلام.
السلام.
Good afternoon, Dr. Ani.
Okay, guys. Today, inshallah, we will try to finish history taking. So the last part in history, who approach for adult, and we will practice pediatric stations as well. Again, to remind you, we have 3 stations for history or psychiatry or toxicology, complex stable patient. Also, 1 pediatric emergency medicine, this one history as well. You have 2 stations for counseling, answer questions. You have 2 stations for resus. You have 2 stations for examination, whatever joint or system examination. You have 2 stations for procedural skills, so 2 stations procedures. 2 stations complex challenging situations, so communication skills. 2 stations for supervise and teach. The most important domain, clinical reasoning decision-making skills, so the management plan in all stations. The second important domain, communication skills, so your attitude inside the room, like empathy, sympathy, good eye contact, give questions in pieces, give information in pieces, and pausing between pieces, okay? Check comfortability, check pain, share decision with actor. The third important domain, organization, prioritization skills. We should be organized in all stations. Inshallah, today we will finish history taking stations. And next session will be psychiatry toxicology. It will be 1 session. Resuscitation will be 3 sessions. 1 for ALS, 1 for ATLS, 1 for APLS and newborn resuscitation. We have 2 sessions for practical skills and teaching stations, 2 sessions for system and joint examination, 1 for system, 1 for joint, 2 sessions for communication skills. Then we will go for mock exams. We almost finished 40 batches for online and face-to-face courses. Some doctors, they ask me for face-to-face courses, and if it is important or not. For sure, if you follow the online course, more than enough to pass with very high score, okay? But if you want face-to-face, we can arrange for that in India, okay? Or according to the center, okay? We are doing batches now for June and July, okay? June and July. So once we finish the teaching sessions, we will do practice mock exams for June only. But now you can practice for June and July. Before mock exams, batch for June and July, you can practice. Once we finish the teaching sessions, we will go for mock exams for June only. And after June exam, we will go for mock exams for July only. I think this is clear, guys, right?
Yes,
Yes.
Doctor.
Okay. Regarding batches for September or December or doctors who joined for next year, 2025, you can attend as a listener, okay? Accuracy, it means checklist, means general approach. You have like 7 categories. You can write general approach of each category. It's not difficult. It will take like 5 or 10 minutes maximum. Accuracy, If you mention all the points, you will get 100% of accuracy. Skillfulness, you should be fluent. Fluent doesn't mean talkative, no. Even you are not talkative, even you are silent, but you ask the question or you give the information with fluency, so it means you are skillful. If you are doing resuscitation without recalling, means you are skillful. Supportiveness, so your attitude inside the room, communication skills. Efficiency, structure, organized. Safety, you cover the safety points. General approach, same. General approach in any history, in any psychiatry, in any toxicology, whatever adult or pediatric, same. So introduction, and then rubber, then the first open question, second open question, and in the end, third open question. Okay. So the first open question you will ask and stop, then sympathy, empathy, then take consent, check comfortability and the pain, take consent. Then the second open question. Second open question, you should repeat the answer of second open question. Then you will follow Socrates or Odibara or who approach. Today we will practice who approach. It means you will divide the approach into 3 parts, before, during, and after. Okay. When to use who approach? If the station is event, like what? Fall, syncope, fits, misbehaving or confused or unconscious, or floppy, like Alti, for example. Okay. You have 8 systems. You have 8 systems, as we discussed in previous sessions. You will follow the general approach, any blah, 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 as we mentioned in previous session. Then you will go for third open question. Would you like to add anything? Then what is your concern? And then give the diagnosis, give the management plan. So the diagnosis according to your data, the most likely problem, blah, blah, blah. So like in general, history taking, if you find the diagnosis is clear, mention according to your data, the most likely problem, blah, 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 blah. If you find the problem is still not clear, the actor is denying everything, so according to your data, there is no clear cause at the moment. And mention the management plan. Who approach? You have 5 questions, and the 6th question you will divide into 3 parts. So 5 questions like what? Who has seen you with this event? When did this event happen? Where did this event happen? Why do you think is the reason behind this event? How many times this event happened in the past? You can say in the past, no need for 6 months. Then what you will divide into 3 parts. No need to ask all these questions. No need to ask all these questions. You can concise them. So you have before you will ask about CNS and cardiovascular more than enough. Because the patient might die from CNS or cardiovascular, but not from vasovagal, not from orthostatic hypotension. So focus on CNS cardiovascular. If you remember all, it's okay. So before this event, any headache, neck or back rigidity, any vision problem, this is very important. Cardiovascular. Before this event, any chest pain, heart racing or sweating. And of course, any yes to CNS symptoms, it means the problem relevant to the brain. If any yes to cardiovascular system, the problem relevant to heart. During this event, more than enough if you ask about jerky movement and tongue bite. Okay, and with yourself. So you have 3 questions during, more than enough. No need to ask everything. Jerky movements, bite tongue, with yourself. After the event, you will ask about any numbness, weakness in your limbs after this event. And regarding confusion, very, very important. After this event, did you recover fully or did you have confusion? This is very important. Any injuries, any bleeding from any orifice, this is very important. Okay. So already we asked about CNS, cardiovascular, and musculoskeletal regarding who approach. So 3 systems already asked. Then you still have 5 systems. I want you to ask very concise. So GIT, no need to ask all these questions. You can say any bowel problem, urogenital, any urine problem, dermatology, any skin changes, miscellaneous, it will be in detail. Height, any temperature, night sweats, lump in your body, did you lose weight or appetite? Respiratory shortness of breath more than enough. Again, most relevant system already CNS, cardiovascular, musculoskeletal, asked and who approach. So you still have GIT, urogenital, dermatology, miscellaneous, respiratory. Only miscellaneous or constitutional symptoms in details. Others will be in concise way. Is that clear, guys?
Yes, sir.
Yes.
Okay.
Clear, sir.
Pediatric, you have the same general approach of adult. Just the modification in the introduction. May I know your name and the relationship with blah blah blah? Nice to meet you, Robert. That's it. How can I help you? Very stopping question. Oh, sorry to hear that. And check comfortability of the child. Is your son comfortable? Does he have any pain? If she said comfortable, no need to comment. If she said he is not comfortable or he is not okay, I will move your son to our team. Then you verbalize your son is in safe hands with our team now. And if the mother at any time said, where is my son? Oh, please calm, sit down, please calm. Your son is in safe hands with our team. Okay. The modification also, you will add prenatal, natal, postnatal, developmental, immunization, and the social history after past medical and surgical and blah blah. Okay. So any problem in pregnancy? What about delivery? Was it normal? After delivery, any admission? Is he growing normal? What about his immunization? Up to date? So ask by this way, concise way. Okay. Social history, no need to ask all these questions. Ask all 7 questions in non-accidental injury or any suspected non-accidental injury. So where does he live? Who lives with him? Where is his father? If the father, where is his mother? Any other carer? Do you or anyone who lives with him smoke, drink alcohol, or by any chance use any illicit drugs? What do you do for a living? Any other child at home? If she said yes, are they okay? Any social services involved currently or previously? Okay. Clear the approach of pediatric guides?
Yes.
Clear, sir.
Okay. Explain new diagnosis. So if they said explain the diagnosis, it means already you have idea about the diagnosis from the ABG, for example, or from the lab. So they can give you diagnosis and crisis. So diagnosis here is the disease, not the crisis. So diagnosis is diabetes mellitus type 1 because a child, or Addison disease, or asthma. The crisis, DKA, for diabetes mellitus type 1. Addisonian crisis for Addison disease. Life-threatening asthma or near-fatal asthma, and the disease is asthma. Okay, so the same approach, introduction. May I know your name and relationship with blah blah blah? Nice to meet you. I'm here to discuss the diagnosis because the examiner asks you to explain the diagnosis. So I am here to discuss the diagnosis with you and take some data from you. Is that okay? How much do you know so far about the condition of your son? Then you will explain the disease, then explain the crisis, and of course you should explain the triggers. No crisis without triggers. Okay. Then explain the same triggers. Any triggers like what? Hypoxia, dehydration, infection, stress, surgery, trauma, and so on. Ask him about ice. Then explain the management plan. Short-term management, it means he will stay in ITU for a few days until return to baseline. He will continue for blah, blah, blah. So injection, for example, long life, information card, and breast. If you are concise like that, more than enough. To get 10 out of 10 in any station doesn't mean you will talk for 30 minutes, no. If you are very concise and mention all the checklist, you will get 10 out of 10. Okay? Then you will go for brief history. If I say brief history, it means without present history. Okay? No need to ask about Odibara or Socrates or any approach. No need to talk about associated symptoms. Again. So you should ask about general approach only. So post-medical, surgical, drug and allergy, prenatal, natal, postnatal, family, and social. Okay? Clear this approach?
Yes, sir.
Okay. We finished already Socrates for adult and finished Odipara and the special station last session. So today we'll go for co-approach, falls. So falls here. What is the most relevant system?
CNS and
Musculoskeletal.
cardio.
So CNS and cardiovascular,
Okay.
musculoskeletal also. Okay, it will be in whole approach already. And syncope the same. Diabetes mellitus, they will give you two actors. Diabetes mellitus, they will give you two actors. So you will introduce yourself to the two actors, and one of them will talk. The other one is unconscious. The one who talk is a friend or the husband or relative, okay? And he will say, my colleague or my wife, unconscious. So you will verbalize, I need to move the patient because the patient is unconscious. You are not talking to the patient now. I need to move the patient to resus room, connect heart monitor, check vital signs, including blood sugar. Then the examiner will say blood sugar is 1 or 2 or anything like that. So you will verbalize, please nurse. You don't have nurse in the room, but just acting. To pass with very high score, you should be acting. Okay, so please nurse, give dextrose 10 ml, sorry, 10% dextrose to 200 ml. Okay, then the actor will be conscious. The actor will act as conscious. Okay, then you will continue. Seizures also the same approach. We have pediatric station, genitourinary. What is the most relevant system for dysuria or urethral discharge?
And
Urogenital.
urogenital.
Genital and GIT.
Okay, SOB and wheezes. So if age less than 2 years, bronchiolitis, if more than 2 years, asthma. So what is the most relevant system?
Respiratory.
Respiratory and cardiovascular. Limbing,
Musculoskeletal and CNS.
CNS.
transient synovitis, okay, Bursa disease or SOFI. If less than 3 years, transient synovitis. For 4 to 10 years, Bursa disease. More than 10 years, SOFI. Rash, it could be ITP if they show you platelet less than 50, for example. H1 if they show you normal platelet and also maybe plus or minus um, blood in stool or urine. Meningococcal meningitis, how to differentiate between H1 and meningococcal meningitis, guys, from the history, from the data.
Position of the
CNS
patient.
symptoms.
CNS.
CNS is
Symptoms.
involved, like headache and neck stiffness, confusion.
Is your son comfortable? Yes. What is the diagnosis?
Henosis conjunctiva.
Is your son comfortable? No, he's confused. He's unconscious.
Meningococcal
Meningococcal
meningitis.
meningitis.
From the first question, you will diagnose. Easy?
Yes.
You find the mother came to you in ER and she is carrying her son. Is it Henoch-Schönlein-Berbera or meningococcal meningitis?
Meningococcal
Even otherwise, okay? If the baby is coming with the mother and he's playing,
Henosis conjunctiva.
clear now? Okay, vomiting. So if the baby is vomiting since birth for continuous 5 weeks, it means hypertrophic pyloric stenosis. If the baby not vomiting since birth, so it could be intussusception, but unlikely to give you intussusception in the exam. Then neglect. So neglect here, it's child abuse, yes. Physical abuse also, yes. For the purpose of the exam, they can give you neglect or physical abuse. Physical abuse, it means a non-accidental injury, okay? They can give you fits or alti, yes, and explain new diagnosis. Okay, we have for practice today. You can raise your hand if you are happy. So, Dawood, Nazar, Ikra, Safwan, Tamil, Fatima, Muhammad, Benjamin, Asma, Atiq, Basamat, Sima, Adil. Okay, if anyone interested to practice, you can raise your hand at any time. Dawood,
Yes, sir. Assalamu alaikum.
alaikum assalam. Please, guys, prepare yourself for feedback. Check if he missed any point and comment on accuracy, on skillfulness, on supportiveness. Also comment on organization, on everything, and try to give him feedback. You have 30 seconds and 6 minutes. You can start.
Okay, sir. Hello, good afternoon. I'm Dr. Daud Nawaz, an emergency registrar. May I know your name and age, please?
I'm Kareem, I'm 65.
Nice to meet you, Mr. Karim. How can I help you today?
Yeah, I fell 2 days ago.
Oh, sorry to hear that. Okay, are you comfortable now?
It's okay.
Any pain?
No.
Okay. Uh, Mr. Karim, can you tell me more about your fall that you had?
Yeah, I was in the farm and I was working and I did not see stones and I slept and I fell down.
Okay, you were in the farm and you were working and you could not see and you suddenly slipped and fell down, right?
Yes,
Yeah. So, Mr. Karim, who has seen you with this fall? Anyone has seen you?
my wife.
Okay. So it occurred 2 days back, right?
Yes.
So do you know what is the reason behind this event?
Yes, I slept with stones and I after that I fell down.
Okay. Uh, So how many times in the past it has happened? Is it
Only this is the first time.
okay? This is your first time, right? So before you fell down, Mr. Karim, you had any heart racing?
No, no,
Okay, any chest pain?
no,
Any excessive sweating you felt before you fell down?
no,
Okay. So you had any headache or any any vision problems?
no, no.
Okay. So before you fell down, Mr. Karim, was there any cough or you felt like any sneeze or anything?
No, no.
Okay. So after you fell down, Mr. Karim, were you able to get up on your own?
Yeah, yeah.
Hello. Okay. So you recovered fully, right? There was no confusion after you fell after you got up from the fall.
No, no. I after the fall, I was okay. I did not lose my consciousness.
Okay, thank you. And regarding yes, did you injure yourself, Mr. Karim?
Yeah, I think I got a swelling in my
Mm-hmm.
forehead. Yeah.
Okay, sorry to hear that. Did you notice any blood over that swelling or somewhere else?
No,
Okay. Uh, uh, Mr. Karim, did your wife, you told me she noticed with this fall. Did she tell you that you had any foam in your mouth or your eyes were rolling up?
no, no,
Okay. Uh, how long, did you wet yourself? Like,
no, no,
did you notice? Okay. So, Mr. Karim, do you had any weakness, any trauma recently?
no,
Okay. Uh, so you had any, do you have any high temperature recently?
no,
Any lumps or bumps in your body?
no,
Any rash or skin changes you felt?
no,
So any change in urine?
no,
Any change in your bowel movements recently?
no. But I got vomiting after head injury.
Oh, thank you for sharing that information. So after you fell down, you had vomitings, right?
Yes. I vomited one time.
Okay. So you had any breathing difficulties?
No,
So any headache?
no,
Okay. Any weakness?
no,
Okay. Any like numbness in your body? Any paralysis kind of feeling in your body?
no,
Okay. Any past medical disease? Hello?
no. I said no,
Okay. Any surgeries in the past?
no,
Are you taking any prescribed medications?
no.
Any allergies?
Thank you. Your time done.
Okay, sorry.
Okay. What do you think, guys? How many marks for Dawood?
6 marks, sir.
It's
Okay. He did not finish his task. He did not reach social history. He did not reach the diagnosis, the concern, the last open question, the management plan. So I cannot give him more than 5 marks. Okay. I feel you are slow, Dawood. Okay. And
Okay.
also, you are trying to explain the question. Okay. So no need to explain the question. You are asking the
Okay.
question and then you are commenting like blah blah blah. Why you are explaining the question? Okay. Did you put yourself? More than enough. Don't say, did you put yourself like you blah blah blah. No need. Clear?
Yes.
Okay. So try to be faster. And of course, in the exam, you will find further 2 minutes, more than enough to get uh, the end of the task. But for this station, I think accuracy, you almost mentioned all the points. Well done. Fluent, you are very fluent. Even you are slow, but you are fluent. Regarding the organization, you are very organized. Okay. So the part you finished, you deserve 100%. But because you did not get your end, so I cannot give you more than 5 marks. Okay.
Okay,
So
sir. No.
what is your decision here? What is the clinical reason decision making? What do you think?
So he's elderly who fell down. So after that, there is a swelling and there is a episode of vomiting as well. So we need to go ahead with CT, and we need to keep him in observation room.
What do you think, guys? Is it correct?
And we need to refer him to the fall clinic as well.
no.
No, sir. He didn't need imaging because he has only one episode and like no like other criteria for CT scan.
Unless he's taken blood thinner medication.
Blood thinning medications, more than
Okay.
2 episodes.
Okay.
Any
Thank you. Okay. So here we can judge by history or by history and examination. I mean by
History and
symptoms and
examination.
the signs or symptoms only.
no
I
by
think
history and
I
examination.
would suggest him that I will be examining him, his head
Okay.
and
Thank you.
brain nerves and back of his eyes. Then
Oh,
after that we can.
okay. Thank you. So according to your data, it seems like you don't need any imaging at the moment. So I give him clinical reasoning decision making according to the data, but I cannot judge by data only. So you can say like that. According to your data, it seems like you don't need any head imaging at the moment. But I need to examine you. I need to examine you. Examine the brain, nerves, and the back of your eyes. And if I find all normal, so I will discharge you with printed leaflet, discharge letter to your GP, refer to fall clinic. Easy? Okay. Also, you can say by different way. You can say, according to your data, you have fall and you injured your head, you have a swelling in forehead, and you vomited once, and you did not get any jerk movements, you did not lose your consciousness. For this reason, you don't need any imaging at the moment, but I need to examine you, okay? By this way. Okay, well done. Next one, Nazar.
Yes.
Okay. You have 30 seconds and 6 minutes. Here, collapse, you will ask the first open question, then the second open question. You will repeat the answer of the second open question. If you still want to clarify after the second open question, you can ask, what do you mean by collapse? Is it loss of consciousness or dizziness? But of course, if the actor explained already, so no need to clarify. Is that clear?
Sir, I need to ask one question regarding previous case. Can I ask?
Okay.
Sir, we don't need to shift the patient to major area or anywhere else on observation.
Any patient with fall, at least move the patient to observation room.
Okay, sir.
Any patient with collapse, move to resus room. But I'm talking about fall, at least move the patient to observation room. Okay. Nazar?
Yes, I'm ready. Good morning. I'm Dr. Nazar, A&E Registrar. May you confirm your name and your age, please?
Karim, 25. Please raise your voice.
Nice to meet you, Mr. Karim. How can I help you today?
Yeah, I collapsed today, doctor.
Oh, I'm so sorry for that. Mr. Karim, I need just to move you to resuscitation room. I'll connect you to the monitor. I'll check your blood glucose. Is that okay?
Thank you.
All right. Are you comfortable now?
Yes.
All right. I'm here today to collect some data from you. Is it okay?
Okay.
All right. Can you tell me more about your problem, please?
Yeah, I was watching TV and suddenly I collapsed.
Oh, I'm so sorry for that. What do you mean by collapse? Is it loss of consciousness or dizziness?
Yeah, I lost my consciousness.
Okay, so sorry for that. So you are watching the TV, then you lost your consciousness. Am I right?
Yes.
When did this happen?
No idea.
And where?
You said when? So it was 1 hour ago.
1
And
hour ago.
at
And
home.
where?
At home.
At home.
Yeah.
Okay. Is it the first time for you?
Yes.
Okay. And why do you think you had a loss of consciousness?
No idea, doctor.
Okay. Any chest pain before loss of consciousness?
No.
Any heart racing?
No.
Any headache or vision changes?
No.
Any cough or sneezing?
No.
Did you change your position from sitting to standing?
No.
Anyone witnessed you?
My wife.
Your wife. Did she reported any symptoms of jerky movement?
No.
Did you wet yourself?
No.
Were your eyes rolled up or back?
No. No.
Any frothy sputum?
No.
Okay. Did you fall?
No.
Did you injure yourself?
No. No.
Okay. And for how long did you lose your consciousness?
No.
Okay. Did you fully recover or partially?
Yeah, after I regained my consciousness, I was okay.
Okay. All right. Any pins and needles or numbness?
No, no,
Any loss of weight or loss of appetite?
no,
Any night sweat or temperature?
no,
Okay. All right. Do you have any other medical condition?
no,
Any allergies?
no,
Are you any prescribed medication?
no,
Any previous surgery?
no,
Do you have any tummy pain?
no,
Any vomiting?
no,
Any shortness of breath?
no,
Any urine problem?
no, no.
All right. Where do you live, Mr. Karim, and with who?
My wife downtown.
And what do you do for a living?
I'm studying.
Okay. Do you smoke or do you drink alcohol?
No,
By any chance, do you use any illicit drugs?
no,
Mr. Karim, would you like to add anything else?
no.
Okay. And what's your concern, Mr. Karim?
What is the problem? Do I need in imaging in admission?
I appreciated your concern, Mr. Karim. According to this information, there is no any clear cause of your loss of consciousness. In the meantime, I'll keep you in resuscitation room, connect you to the monitor, and check your vital sign. We'll do general examination for you. This include your brain, nerve, back of your eyes, nose, ear, and throat, your heart and your lung as well. We'll do blood tests, include complete blood test, liver function, kidney function, heart function. We'll do heart racing. This is called an ECG. And all right, Mr. Karim, I think there's some abnormality in your heart racing. This is it's called Borgata syndrome. This is a genetic problem affecting the electricity in the heart. Due to this reason, I think you need admission under the cardiology team, the heart doctor. They will fix a small device in your chest to protect you from the complication of this issue. So this is can end it by irregular heartbeat, and it will be life-threatening. Do you understand this plan?
Thank you.
Mr.
Your
Karim,
time done.
thank you.
What do you think, guys? How many marks for Nazar?
9 marks.
7 marks.
Why 9? Why 7?
His voice is not clear, sir.
Okay, his voice not clear. When you are listening to the recording, Nazar, you can compare yourself with other doctors, okay?
Okay. I think I have problem with the headset.
Yes, in a way, in the exam, you will find the examiner maybe away 1 meter, 2 meters. Sometimes he is very close to you, between you and the actor. Also, the camera is recording, so it's the same headset, right? So try to fix the problem. Anyway, what about the approach, guys?
I think he was very good, but he was
Very good, sir.
returning to the questions and repeating the questions again, like chest pain, cough, abdominal pain. He already asked about them.
Okay, so regarding accuracy, he did very well. Regarding organization, very organized, and regarding skillfulness, he's very fluent. He's not fast and he's not slow. That's good in history. He controlled the time. He mentioned most of the points. And regarding comfortability and pain, he moved the patient in the beginning, so safety points covered. He is very fluent, okay. Even he's not fast, but he's very fluent. So I did not give him any clue. I mean that I want to test his skills. He gave me good management plan, and once I show him the heart racing, He mentions a problem, but I wish if he say, I'm sorry to say that, he's not showing empathy when he said problem. So you can say, according to your heart racing, I'm sorry, it seems like problem, syndrome, which is called in medical term Brugada syndrome. Once you finish explaining to the actor, Nazar, are you with me?
Yeah, with you.
Yeah. Once you finish with the actor, if you still have time, turn your head, look at the examiner, and tell him, I can see down-sloping ST elevation in V1, 2, and 3. Easy?
Okay.
So why I said turn your head to the examiner? Because it's medical terms. So show the examiner that you are talking to him. Clear?
Okay, I see.
Yes, well done. So I will give you 10 out of 10 and I'm happy also, okay?
Yes, thank you.
Well done. Next one, Ikra.
Yes, sir.
How are you?
I'm good. How are you?
Yeah, fine. Okay, next station. Let's see. Okay, collapse again, but
Mhm.
different diagnosis, okay?
Okay.
Yeah, you have 30 seconds and 6 minutes. Same approach.
Okay.
You can start.
Hello. Good evening. I'm Dr. Ikra, one of the ED doctor. May I confirm your name and age, please?
Karima, 25.
Nice to meet you, Miss Karima. So, how can I help you today?
I collapsed today, doctor.
I'm really sorry to hear that. I need to move you to the resuscitation room, check your vital signs, and attach to the cardiac monitor to make sure you're okay. Are you comfortable?
Yes.
Do you have any pain?
No.
Miss Karima, I need to take some data regarding your condition. Would that be okay for you?
Okay.
Okay, can you tell me more about your collapse, Miss Karima? Hello?
Yes.
Can you tell me more about your collapse, Miss Karima?
Yeah, I was in the kitchen and I was cooking and suddenly I collapsed.
Okay, so you have tell me that you was in kitchen and you were standing and doing cooking and then suddenly you collapse. Am I right?
Yes.
So when did it happen?
You should
When
ask,
did it happen?
you should clarify.
Okay, so Miss Karima, what do you mean by collapse?
Should
Hello?
clarify. Asking me, what do you mean by collapse? Is it loss of consciousness or is it dizziness?
Okay, what do you mean by collapse, Miss Karima? Is it loss of consciousness or like dizziness?
Yes, I lost my consciousness
I'm really sorry to hear that. So when did it happen?
1 hour ago.
And like who has seen you with this collapse?
My husband.
Okay, and Miss Karima, do you think why do you think that you have this collapse? Hello,
Yes.
why do you have this collapse?
No idea, doctor.
Okay, and how often do you have this collapse? Is it this first episode?
Yes.
Okay, Miss Karima, can you tell me is there is any recent head injury?
No.
Okay, can you tell me is there is any headache or neck stiffness before this collapse?
No.
Any loss of visions?
No. No.
Any chest pain? Any dizziness?
No.
Any sweatings?
No.
Is this collapse happen when you are trying to stand up from a sitting position?
No. No.
Okay, and during this collapse, did your witness told you that there is a foam in your mouth or uprolling of your eyes?
No,
Is there is any jerky moments?
no,
Did you soil yourself wet or did you wet yourself or soil yourself?
no,
Okay, did you bite your tongue?
no.
So, how did this episode last for?
Like 5 minutes.
Okay, and did you manage to get yourself up after this collapse?
Yes,
Okay, and Miss Karima, can you tell me, is there is a episode of confusion after this collapse, or you recover fully?
I recovered fully.
Okay, and bite? Did you bite your tongue or sustain any other injury in your body after this collapse?
No,
Okay, is there is any numbness, weakness, or paralysis after this collapse?
no,
Okay, Miss Karima, can you tell me, is there is any tummy pain,
no,
any shortness of breath,
no,
any change in your urine?
no,
Okay, can is there is any rash on your body?
no,
Is there is any high temperatures?
no,
Any lumps and bumps in your body?
no,
Okay, did there any change in your weight or change in your appetite?
no.
Okay, Miss Karima, is there is any past medical illness?
Yeah, I have anemia before.
Mm-hmm. Okay, so can you tell me what's your last LMP, last menstrual period?
It was 4 weeks ago.
And by any chance, are you pregnant?
I did not check.
Okay, and so Miss Karima, can you tell me, is there is any previous surgeries?
No,
Okay, any prescribed medication are you taking?
no,
Any allergies?
no,
Any condition run in your family?
no.
So, Miss Karima, what do you do for your livings?
I'm teacher.
Okay, and Miss Karima, so can you tell me where are you living and with whom you are living?
My husband downtown. Thank you.
Okay,
I'm done. Thank you. Okay, how many marks, guys, for Ikra?
7 marks, sir.
Okay, so this patient, I did not give any clue, and I give you history of anemia. So what is the most likely problem, Ikra?
so maybe she's like she's pregnant, and maybe likely due to his pregnancy.
Okay, so maybe anemia again, right?
Yeah.
Okay.